start our discussion here on the brainstem and cerebellum. But before I start our discussion, I'm going to give you a little bit of background with regards to the development of the brain or how the brain is organized. So let's take a look at what happens or what's going on here with the embryo. You have here the so-called neural plate. What happens is during the embryo's development, this neural plate is going to invaginate, and then you're going to have these so-called neural folds here on either side. And then eventually this fold is going to come together and then create and form a neural tube. Now, the neural tube, that during about the latter part of the 4th week of development is going to create some bulges or some vesicles. So let me go over here to this image right here, this slide. So 1, 2, 3. So for example, the neural tube is going to have some dilations. Write that word better. Dilatations, anteriorly speaking, and you're going to have the primary vesicles. You're going to have these primary vesicles, 3 primary vesicles, and these are the primary vesicles: prosencephalon, your mesencephalon, and finally your rhombencephalon. So again, these are just these little bulges that develop during the latter part of the 4th week of development in the embryo, forming these so-called 3 primary vesicles, and they are the prosen, mesen, and rhombencephalon. Now, by the time we get to the 5th week of development, what happens now is you end up with 5 secondary vesicles. 5. So keep in mind 5 weeks, 5 secondary vesicles. And so the prosencephalon is going to give rise to the telin and diencephalon. The mesen stays the same. The rhombencephalon is going to give rise to a metencephalon and a myelencephalon. And keep in mind, folks, this is what's going to develop or organize the brain into its specific components. And then you have the telencephalon going to give rise to the cerebral hemispheres. The diencephalon is going to give rise to the thalamus, hypothalamus, and epithalamus. The mesencephalon is going to give rise to the midbrain. I'm going to give you some terms here. You have tectum, you have the tegmentum. Okay, I'll show you those in a cross section. The metencephalon is going to give rise to the pons and to the cerebellum, and then the myelencephalon is going to give rise to the medulla oblongata. So here's a picture showing you how, or the fate of these little bulges, how they're organized. So again, here's your telencephalon. Let me just write right here. So here's the outline of your telencephalon. Then you have your diencephalon in the embryo. Then caudal to that's going to be the mesencephalon. Then you're going to have the metencephalon. Caudal to that, you're going to have your myelencephalon. And then caudal to that, folks, that will continue, the neural tube will continue and develop eventually into the spinal cord. Keep in mind, the order of structures, as I described it right now, is rostral to caudal. Okay, that's the order of, in terms of direction, rostral to caudal. I did address these terms at the very beginning of the course. Okay, so the brainstem. Now the brainstem is subdivided, is broken up into 3 parts. You have the midbrain, pons, and medulla oblongata. Again, the order is from rostral to caudal. The brainstem serves as a conduit for ascending and descending tracks. You guys remember what tracks are? Tracks are axons, right, that you find in the what? In the CNS. Ascending tracks is sensory versus descending is what? Motor output. The brainstem also serves as a reflex center for the respiratory and the cardiovascular system functions, vital function, I should say. And the brainstem also serves as a housing unit, so to speak, for the nuclei for the cranial nerves numbers 3 through 12. Keep in mind there are 12 pairs of cranial nerves, but as far as the brainstem is involved, it houses the nuclei for cranial nerves numbers 3 through 12. Take a look at the midbrain. The midbrain, some of the parts, you have your cerebral peduncles. Peduncle is a fancy term that alludes to some kind of stalk for the cerebral hemispheres. You have your cerebral aqueduct. This serves as a drainage site for CSF from the third ventricle to the fourth ventricle. I'm going to elaborate further on this when we get to the topic of the meninges and ventricles and whatnot. But for the time being, folks, let me just introduce this structure here because it does occur in the midbrain. It is a drainage site. It is a conduit between the third and fourth ventricle in terms of the drainage of cerebral spinal fluid. Now, the cerebral aqueduct, or we also call it the mesencephalic aqueduct, sometimes can encounter problems with regards to development. If there is stenosis of that cerebral aqueduct, this can culminate in a condition in the newborn known as hydrocephalus. What happens is, since having stenosis or lack of development of that cerebral aqueduct, then that will not allow for proper drainage of the CSF from the third ventricle into the fourth. And then what happens is that you have a buildup of CSF within the brain, within the ventricles. There's swelling in there, and then it results in a swelling of the infant's head region. Now, the corpora quadrigemina, that's a term that describes the superior and inferior colliculi. You have two pairs of these, make them four, hence the term quads. This is pretty much sensory nuclei. Now, the superior colliculus serves for visual input, and the inferior serves for auditory input. So if you look at this picture here, here's the so-called corpora quadrigemina. You have the superior and inferior colliculi. You have here your visual pathway. Okay, you have here your optic nerve, going back towards your chiasm, and then you have your optic tract here. And notice how this continues onward to this bulge right here. This is the lateral geniculate body, and this will continue towards the superior colliculus for visual input. You have another bulge here, the medial geniculate body, that's G, and this will this is in contact or connection with the inferior colliculus, which is for auditory input. So you have superior colliculus, inferior colliculus, and this cohesively is what constitutes the corpora quadrigemina. Also, since we are talking about this part here, the corpora quadrigemina is also a term that describes the tectum of the midbrain, or mesencephalon. And notice here, folks, how the little purple area is what outlines our topic of discussion here, and the cerebellum. Okay, so let's take a look at the midbrain now. Some other structures or features to the midbrain that can normally occur there. You have the red nucleus. This under fresh specimens has a reddish appearance due to its high vascularity, good amount of vascularity. It has A fibers and E fibers. A stands for afferent, and E stands for efferent. Okay, you know what afferents are and efferents are. Now the afferent fibers connect. You have afferent fibers running from the cortex of the brain to the spines, spinal cord, coursing through the red nucleus. There are also afferent fibers that connect the cerebellum. There are also afferent fibers that connect the substantia nigra to the red nucleus. Now there are efferent fibers that connect the midbrain to the spinal cord and to the substantia nigra. Now the substantia nigra, folks, is simply an area of nuclei. You may recall these motor neurons, these neurons, but they are motor neurons, that they possess melanin. You recall this from an earlier discussion. Melanin, that's a pigment. Okay, and these neurons are also responsible for producing a dopamine, neurotransmitter dopamine. They're involved in maintaining muscle tone. This is function of the substantia nigra. It does have connections to the cerebral cortex, hypothalamus, the basal nuclei, and the spinal cord. Here's a picture showing you can best see the red nucleus and these other parts in terms of substantia nigra and red nucleus through cross section. So here's a cross section to the midbrain. Now let me get you oriented in terms of what's anterior, what's posterior. This is anterior, this is posterior here. This that I'm outlining right here is the red nucleus. Notice how it is indeed bilateral. The substantia nigra is this part that's here, reddish in color. Because of the staining process, the other structures look rather different. They are supposed to be black, but it's stained kind of lighter in color. Here's where you have your aggregates of these nuclei, known as the substantia nigra. Now, here, let me subdivide or address some of the parts. This part right here is considered, this right here, is considered the crus cerebri. Outline it right here. Here's crus cerebri here. Here's bilateral. And what's going on here, folks, what this has is an aggregate of descending tracts. Now, when you're running from here to here, sorry, let me just try to put this better here. I'll just include this here. The area that I'm outlining right here, this is the so-called tectum. So pretty much the substantia nigra separates the crus cerebri from the tegmentum. Small little area here within the midbrain. And then right here, folks, a small little area right here. This would constitute the tectum. At this level, we are looking at the colliculi, parallel colliculi. Okay, so not much to add to that. And keep in mind, folks, right here is your central canal. And what you find coursing through there is CSF, cerebral spinal fluid, coursing through a little space there. Okay, so let's continue on here. That's the midbrain, cross section of it, and then let's go a little further down I would say at this level, this would be the superior colliculi at this level. And as you go further down, here's the inferior colliculi. And again, here's your, I'm outlining the crus cerebri, where you have your descending tracts. Here you have the substantia nigra. Now here you have a connection between the midbrain and the cerebellum. These are the fibers for the superior cerebellar peduncle. Again, just an area of fibers that connects the midbrain to the cerebellum. And again, folks, here, again, you have your little opening in your central canal that has CSF. Keep in mind that when you're talking about connections to the midbrain, as I said earlier, the connection or the afferent fibers that course to the from the midbrain to the cerebellum is through the superior cerebellar peduncle. Now, don't get tricked here, folks. Be careful with the nomenclature. This is the cerebellar peduncle, not cerebral. Cerebellar peduncle. Don't confuse that with the crus cerebri or the cerebral peduncles. Cerebellar peduncles. Okay, so not much to add to that. Let's move on, folks. Now we're moving on to the pons. It's wedged between the midbrain and the medulla, so I'm going to outline here. Here's a gross depiction, inferior view of the pons right here. And here's a cross-section of that. So again, this is anterior, this is posterior, this is the central canal that has CSF. So on a given image, you should be able to recognize a cross-section of the pons. Notice how it differs from that of the midbrain. Midbrain looks like it has ear-like structures. Okay. That's your pons. Now here's a posterior view of the pons. And here we're going to take a look at the cerebellar peduncles. Now, I'm going to outline some peduncles here, folks, to be more specific. Here are the superiors. Here's the middle superior cerebellar peduncles. Here are the middle cerebellar peduncles. And then here are the eyes for inferiors. Obviously, you can tell that the superior cerebellar peduncles connects the cerebellum to the midbrain. Okay. The middle cerebellar peduncles is a communication line between the pons right here, connects the pons to the cerebellum, and we're talking about a one-way connection. One-way communication from the pons to the cerebellum. What it does, folks, is simply advises or alerts the cerebellum of voluntary motor activities that are initiated by your motor cortex. It's a one-way signaling from the pons to the cerebellum. And then your inferior cerebellar peduncle, remember, cerebellar peduncles, this connects the medulla oblongata, which is this part right here, the medulla, to the cerebellum. And this pretty much conveys sensory information to the cerebellum from your proprioceptors, remember that? Your proprioceptors, how are we going to say that? Proprioceptors from your muscles and so forth. Okay, so make sure you're aware of where your superior peduncles are, your middle, and your inferior ones, and where they connect what to where. posterior view of the pons. And also keep in mind, folks, you're also peering into the, by removing notice how the cerebellum has been removed, and you're peering into this opening here called the rhomboid fossa, little opening, and this space right here is the location of the fourth ventricle. Keep in mind, folks, right before that you have your cerebral aqueduct that runs within the midbrain. So this area here is the midbrain. This part here is your pons, and everything below here is your medulla oblongata. Okay, your medulla oblongata, what do you have there? You find some pyramids, you'll find your olive that have nuclei that are responsible for your voluntary movements. Okay. It also has a decussation point. Decussation is a fancy term that describes a crossing over of the signal from one side to the other. Crossing over. Decussation point. I'll show you where that is, where that occurs. And you will also find in the medulla oblongata some motor nuclei for some of your visceral functions, for your cardiovascular, for your rhythmicity, for your breathing patterns and others, hiccuping, swallowing, coughing. In other words, when you give a patient a cough suppressant, the purpose of that medication is to target the motor nuclei in the medulla oblongata and suppress the coughing. Okay, and here's a picture showing you the medulla oblongata. Here are the so-called pyramids right here. You can see them outlined here. This is showing you the little decussation fibers. The fibers cross over. This is the location, more or less, of the olivary nuclei here and here. Little bulges there on either side. And again, this is anterior, this is posterior. Here's a cross-section of the medulla oblongata. And let me see some structures here. Here, what really stands out, folks, is this olivary nuclei. Olivary, or what's known as the inferior olivary nuclei here and here, okay? And you can also see here in this picture, we can see the, here's some pyramids here. Okay. And since it is we are in the vicinity of the medulla oblongata, definitely this is the fibers for the inferior, cerebellar peduncle. As I said earlier, the inferior cerebellar peduncle connects the medulla oblongata to the cerebellum. Here's another cross-section here of the medulla. Again, this is posterior, this is the anterior. Here are your pyramids here. Okay, there are more pyramids. But here, what I'm outlining right now, that part right here is the decussating fibers. Decussating fibers right here. It's crossing over of the signaling that occurs. Keep in mind, also, folks, you can see here, let me see, not much to add to that, I don't think. Let me move forward here. This is a posterior view of so this is anterior view of your medulla oblongata, right here, and this is a posterior view. And here, what juts out at you are these structures. You have these tubercles here. This is your crassal tubercle, and this is the cuneatus. You recall that term when we were talking about the fasciculi in the spinal cord. So tubercle here, tubercle that's lateral to it. I'm sorry, over here. Here's your gracile tubercle, and lateral to that is your cuneatus. Okay. So here's a cross section showing you the medulla oblongata, showing you the nuclei of those tubercles. So here's your nuclei gracilis and your nuclei cuneatus. Nuclei here, nuclei here. Medial, this is medial, this is gracilis, and this is cuneatus, which is lateral. And again, folks, your point of reference here, that's your little central canal where you have CSF flowing through there. Not much to add to that, so folks, let's work on down to our discussion of the cranial nerves. Now, you have 12 pairs of these, and I've outlined it nicely for you so you can have a good understanding of where these structures arise from. Now, I'm also going to address the TO. TO stands for, this acronym stands for topographical origin. Topographical origin of the cranial nerve, or where it exits from the brainstem. So, for example, you have your cranial nerve number 1, which is your olfactory nerve. It is pure sensory, only sensory, for your sense of smell. And this originates from the telencephalon. Your cranial nerve number 2, optic nerve, again pure sensory, for vision. This originates from the diencephalon. Here's a picture showing you the olfactory bulb that leads to olfactory tract, so forth. And then here's your optic nerve here, leading back to a chiasm, and then optic tract. And as you all recall, that leads to a lateral geniculate body and over to the superior colliculus. That's your visual pathway, pretty much. So and these are your TOs for that. Then you have, again, a gross depiction of that here, and here's your cranial nerve number 1, and your optic nerve is number 2. Now we're going to get to the 3rd and 4th cranial nerves, oculomotor, as the name implies. This is pure motor. Trochlear nerve, pure motor. This is for eye movement, especially when you're innervating the extra ocular muscles that we'll talk about in a bit. Now, these two, their TO, topographical origin, is the mesencephalon, or the midbrain. And here's the nerve right here, your oculomotor nerve right here, and your 3rd nerve and your 4th nerve right away, trochlear nerve. So these originate from the midbrain. Then you have cranial nerves number 5, the 5th one, your trigeminal nerve. Now this one is mixed. What's meant by mixed? Mixed meaning you have motor and what? And sensory. Motor and sensory. Now it has 3 divisions. There are 3 subdivisions or 3 divisions to the 5th cranial nerve, or the trigeminal nerve, which include division 1, V1, the ophthalmic division, V2, the maxillary division, and V3, the mandibular division. So you have 3 divisions of the trigeminal nerve as it comes off of the brainstem. I'll go further into these divisions because they are important when it comes to where they exit through in terms of the skull. Then you have your adducent nerve. This is obviously another motor nerve involved in eye movements. And then you have a facial nerve. That's a mixed nerve, motor and sensory. Now, in terms of topographical origin, this one, its TO is the metencephalon. Now, the remaining cranial nerves that I'm going to talk about, in terms of number 6, number 7, let me just continue on here. I'm sorry, I have some more information to talk about here. Number 6 and 7, let's just, to be safe, their TO is the medulla, or I should say the myelencephalon. I should say cranial nerves 6 through 12, their origin would be the myelencephalon. Now, let me see here if I have to add anything else. Okay, so again, overview, folks. We're going down from cranial nerve number 1, 2. Then you have your third cranial nerve. Number 4 is your fifth one. Now, keep in mind, and let me address it. This is important here. Notice how cranial nerve number 5 and number 7. Notice how they have a thick and thin root. So this is important to know because the thick, in terms of roots of the trigeminal nerve, roots, they're thick and thin. The thick for the trigeminal is sensory, while the thin has motor fibers. When it comes to the facial, the roots is opposite. Thick, thin. The thick is motor, the thin is sensory. And again, your cranial nerves here, number 5, 6, number 7, come to 8 yet. Now, this is an important picture right here, folks. This is showing you what happens when the facial nerve exits the skull. I'll talk about in the discussion of the skull of where that hole is, but for the time being, let me just introduce to you the breakdown of how the facial nerve branches once it exits the skull. Now, let me change in color here real quick. So, for example, you have a little arrow here, the black arrow. This is showing you the following. This is the temporal branch. Remember, there's 5 branches that I'm going to emphasize on. You have one back here, but I'm not going to even talk about that one, okay? Don't worry about that. Temporal branch, right? Then the next one, where the red arrow is, that's the so then you have this one here, where the red arrow is. That's your zygomatic branch. You see the temporal branch. And then you have here the red arrow. This is the zygomatic branch. Zygomatic branch of that facial nerve. Okay, now the blue arrow that is showing the buccal branch. Follow the branch here. This is your buccal branch of that facial nerve. The yellow, this is the mandibular branch, right? Mandibular branch of that facial nerve, or they also call it marginal marginal mandibular branch of that facial nerve. And then finally, you have your cervical branch. Cervical branch of the facial nerve. So again, my emphasis is on the branchings of the facial nerve as it exits out of the skull. And you see them right there. Okay, so we're done with that, folks. Now let's go into eye movement. Here are the muscles with regards to the movement of the eyeball. Now, these are also known as your extraoculars, outside of the eyeball. You have 4 rectus muscles: superior, medial, inferior, and lateral. Okay. Then you have your obliques. You only have 2 of them: superior and inferior oblique. And here they are. So if this were a right eye, right? Correct. So she said. Here's your orbit. Here's your medial rectus. Here's your lateral rectus. Here's your superior rectus. And here's your inferior rectus. So you have 4 rectus muscles. And you have 2 obliques. Superior oblique, inferior oblique. 2 obliques, 4 rectus muscles. Now, in terms of their innervation, let me give you a very quick, succinct formula to help you remember this information. Here you go. SO4, LR6, 3. What this is illustrating, folks, is that the superior oblique muscle, SO, is innervated by cranial nerve number 4, right? The lateral rectus is innervated by cranial nerve number what? 6. And all the remaining muscles are innervated by cranial nerve number 3. So again, you have SO4, LR6. The remaining cranial nerve muscles are innervated by cranial nerve number 3, or your oculomotor nerve. Okay, so now this is showing you a picture of what happens when you have third nerve palsy. Third nerve palsy, or what's known as down and out syndrome, I believe is what they call it. This is where you have a lesion in that nerve. Could be caused by compression of that nerve by a aneurysm, a baryaneurysm, a bulge of an artery compressing on that nerve. And then this allows you to lose control of movement of the eye, and this is the end result. It just simply goes down and out. Third nerve palsy. Now here you have what's called abducent nerve palsy, or cranial nerve 6 palsy, 6th nerve palsy. What's happening here is that in the physical exam, the doctor's holding up an object and having the patient follow the object visually. Notice how the right eye has movement. It is able to follow the direction of the gaze of the object. However, the left one does not move because the left eye was not able to abduct, or in other words, move the eyeball in this direction, because there is paralysis of that nerve, of that muscle on that side. Okay, this is a condition known as Bell palsy. This coincides with the facial nerve, cranial nerve number 7, right? Where you lose the ability to control some of the musculature of the face, of muscles of facial expression. You have a dropping of the eyelid, dropping of the lip on that side, so forth. So you have somewhat of a droop to one side of the face. Okay, so let's continue on with the cranial nerves. You have number 8, number 9, number 10, 11, and 12. As I said earlier, to be safe, let's say that the TO for these cranial nerves is the myelencephalon. Myelencephalon. cephalon. Okay, cranial nerves numbers 6 through 12. All right, you have your vestibulocochlear. This is your pure sensory, your glossopharyngeal. It is a mixed nerve, motor and sensory. Vagus nerve is mixed, accessory, pure motor, hypoglossal, pure motor. It's involved in your tongue movements. Now, let me summarize for you the basic function of the cranial nerves in terms of their numbers. So, in terms of motor, cranial nerves, what? 3, 4, 6, 11, and 12. Pure sensory, cranial nerves 1, 2, and 8. Mixed, we have 5, 7, 9, and 10. So a quick summary of what's motor, what's sensory, and what's mixed. Now, in terms of cranial nerves that have parasympathetic fibers, those include 3, 7, 9, and 10. In terms of carrying parasympathetic fibers. Okay, so now let's move on to, let's see, topographical origin. We covered all that, okay? Branches of the facial nerve. Now, this is the famous painting called the Scream, and it is perceived, it is understood that this person may be screaming not because of, I don't know, for whatever reason it's depicted here, but people, there is a condition, there is a problem with some patients where they have overstimulation, pain stimulation in the 5th cranial nerve, and that condition is known as trigeminal nerve neuralgia, or it causes a condition known as tic-douloureux. It is considered one of the most excruciating pains that an individual can experience, a human can experience. It's a pain in the side of the face, depending on which side of the head is occurring or the lesion is at. So this coincides with the trigeminal nerve and is known as trigeminal nerve neuralgia or 5th cranial nerve neuralgia, or just simply tic-douloureux. That explains why this painting may also be an expression of a person experiencing tic-douloureux or trigeminal nerve neuralgia. Very excruciating pain. Okay, here's again an overview of all the cranial nerves, numbers 1 through 12. This picture here is what I wanted to emphasize on here is very simply, mainly, to explain how the cranial nerve number 11, it has cranial and it has spinal roots. And if you look here, this opening right here, this skull opening is the exit point for your cranial nerves number 9, 10, and 11. I'll go into more detail on which hole this is in another discussion. However, notice how you have here the cranial root of the accessory nerve joining this band of nerves and going out through here. But notice how here you have a spinal root of the accessory nerve coming off of the spinal cord further down, like here, okay, and eventually joining this mesh nerves and going out through this hole. And notice how this spinal root of this cranial nerve is entering into the skull. It goes into the skull, it comes off the spinal cord, it goes into the skull through this hole called the foramen magnum, this opening in the base of the skull. And then it enters into here, joins his band of nerves, and goes out to another hole here. So again, keep in mind that there is one cranial nerve that enters into the skull. That's the spinal root or spinal part of the accessory nerve, which is cranial nerve number 11. Okay, the cerebellum counts for 10% of your total brain mass. It's got two hemispheres, or these so-called cerebellar hemispheres. It has a vermis, which is simply just a ridge, an elevation in the median, in the midline. Folia, these are simply the elevations of the cerebellum. You'll notice how it has these little elevations and little crevices. You have a fissure, that's a groove, a deep groove that separates the anterior from the posterior lobes. The cortex of the cerebellum has these Purkinje cells. These are simply multipolar neurons. And then you have a arrangement of white matter within the cerebellum called the arbor vitae. That's a Latin term for tree of life. And you can best see that when you have a sagittal cut of the cerebellum. So here we go. Picture showing you the here are the two cerebellar hemispheres. Here's the primary fissure, a groove that separates the anterior lobe from the posterior lobe of the cerebellum. You can see and appreciate here all the elevations here, all these elevations here. Notice how they're more straight in comparison to the elevations here in the cerebrum. These are more straight. Okay, these are the so-called folia of the cerebellum. And then you have this ridge, the median, called the vermis. Now here's from your atlas, from your book, showing you, again, the cerebellar hemispheres here. Okay, and if you flip it over, you can see the inferior aspect of the vermis. And then you have your so-called flocculus. Now this structure is of clinical significance because, or flocculus, I should say, or your tonsils. Your flocculus / tonsils. Tonsils here. I'm sorry, this is the part that's of significance because, and here's a sagittal view of the cerebellum. Again, I'll get to that tonsil in a bit. Again, here's your cerebellum. Notice how you have your cortex, the gray matter on the outside, and you have the branching area of white matter within the cerebellum on the inside, the so-called arbor vitae or tree of life within the cerebellum. But you can best see it in a sagittal view of the cerebellum. And here's what I wanted to show you, the herniation. Herniation of the cerebellar tonsils right there. And also you have herniation of your medulla oblongata and your medulla. It's also herniated. This phenomenon is known as Arnold-Chiari phenomenon, or syndrome. I'm not quite sure what they call it nowadays. It's a scenario that can be acquired at birth in a newborn, and this can be life-threatening, of course, when you have the tonsils of the cerebellum that are going to plop through, herniate through the opening of the skull, the foramen magnum, along with the medulla oblongata dropping further down into the spinal canal also. Arnold-Chiari. What it is herniation of the cerebellar tonsils and also herniation of the medulla oblongata. This is some histology, folks, just to show you the cortex, what it is composed of. You have cerebellar cortex, you have gray matter on the outside. You have this. All this right here is gray matter. All this right here. You have a molecular layer that's lighter in color, and you have a darker, more pigmented granular layer of that cortex. And deep to all this is the white matter. Here, showing you some of the cellular composition of the cortex. Here's the molecular cellular layer. You have some Purkinje cell layers here. Again, multipolar neurons here. And also you have some basket cells here. The basket cells are interneurons. And their neurotransmitter is GABA. Along with the Purkinje cells, they also secrete GABA. Remember, folks, that's an inhibitory neurotransmitter. Okay, then deep to all this is gray, and deep to all that, you'll find your myelinated axons to make up the white matter of the cerebellum. And folks, that concludes my discussion on the brainstem and cerebellum.